CPR. What is CPR and when to do one? CPR stands for cardiopulmonary resuscitation. It is a life-saving technique that's useful in many emergencies, like when a person's breathing stops or when a heart stops beating or when there's agonal breathing. CPR restores the partial flow of oxygen-rich blood to brain and other vital organs. It is achieved by maintaining cardiac output until medical assistance arrives and restores a normal heart rhythm. The physiology of CPR involves generating a pressure gradient between the arterial and venous vascular beds. CPR is effective only if performed within 7 minutes of the stoppage of blood flow. The brain may sustain damage after blood flow has been stopped for about 4 minutes and irreversible damage after about 7 minutes. The heart also rapidly loses the ability to maintain a normal rhythm. Low body temperatures, as seen in near drownings, prolong the time the brain survives. Following cardiac arrest, effective CPR enables enough oxygen to reach the brain to delay brainstem death, and allows the heart to remain responsive to CPR. Sudden cardiac arrest, wherein the heart stops beating, is the leading cause of death in adults. If you see someone collapse, here's what you should do. Follow the DRSCAB. D stands for danger. Prior to approaching the patient, ensure scene safety for both you and the victim. Once scene safety is ensured, approach the victim. Kneel down beside the victim and put the patient on their back on a firm surface. R stands for response. Check for response from the patient. A. Is the person alert? Is he moving? If not, V. Do they respond to your voice? If not, P. Place your hand on their shoulder and gently shake them. Ask loudly once again if they're all right. If not, assume the patient is unresponsive. S stands for shout for help. If they don't respond and if you're with another person, have one person call the ambulance. The other person should begin the CPR. If you're alone, don't leave the victim alone. If you happen to have a phone, call an ambulance before beginning CPR. Check for the breathing pattern. If they're not breathing, start chest compressions, aka CPR. C stands for chest compressions. Place the heel of your hand in the middle of the victim's chest, between the nipples. Now lock your fingers by covering your first hand with the other hand. Lock your elbows at the correct posture. Push down with all your body weight, depressing the chest 1.5 to 2 inches. Push down hard and fast. Try to maintain a rate of 100 beats per minute. Allow the chest to recoil or spring back after each compression. Now, if you're untrained, continue CPR until they show signs of life or until the ambulance arrives. If you're trained, move on to the next 2 steps. A stands for airway. Open the victim's airway using head tilt or chin lift maneuver. Place your palm on their forehead and gently tilt the head back. Now gently lift the chin forward with the other hand to open the airway. B stands for breathing. Look, feel and listen for no more than 10 seconds. If the patient is breathing, stop the CPR. Put the patient in recovery position. Bend one arm and keep the leg straight. Place back of the person's hand against the cheek and hold there to support the head. Pull bent leg and roll the person towards you. Hand supports the head. Bent knee prevents rolling. Bent arm gives stability. If the patient is not breathing, after opening the airway, pinch the nostrils shut. Cover their mouth with yours, making a seal for mouth-to-mouth resuscitation. Give the first rescue breath, lasting 1 second. Watch to see if the chest rises. If the chest rises, give a second breath. If the chest doesn't rise, repeat head tilt and chin lift, and then give the second breath. Be careful not to provide too many breaths or with too much force. Resume chest compression to restore blood flow. Start CPR with 30 chest compressions before giving 2 rescue breaths. Assess the circulation by looking for movement, coughing or breathing. This step is not advisable in the current scenario due to the COVID pandemic. If the breathing doesn't resume, continue CPR. Don't stop until help arrives or until the patient shows signs of life. The procedure of giving CPR is same for adults and children above 1 year of age. The only exception is that we use the heel of only one hand to give CPR in children above 1 year of age. In babies who are 4 weeks or older, cardiac arrest is usually due to lack of oxygen, mainly caused by choking. If you don't know why the baby is choking, start CPR immediately. The steps are all the same except when it comes to the chest compressions. Chest compressions should be given gently using the tips of 2 fingers, and not the whole hand. Chest should be compressed to not more than 1.5 inches. Summarizing the steps of CPR.
Hey, thanks for watching. If you liked my video, please like, share and subscribe to my channel A to Z Medicos. Hit the bell icon to stay tuned.